So this is a what's in my nurse practitioner clinical bag. Hi guys, and welcome back to Jenean's Journey. So as you can tell, this is a what's in my nursing bag. I mean, let's just look at this. It's like a Barney bag. Y'all ready? Let's go ahead and unpack it together. I'm gonna do this one a little differently because I'm just gonna go ahead and unpack my bag. Pretty much some days all of this is in this particular bag or a different bag. You guys know I have lots and lots of bags, and if you don't know, now you know I have a ginormous amount of bags that I switch in and out of for school, for clinic, or even just for, not for work, but more so for clinic. Let's go ahead and unpack this bag and let me tell you everything that I take to clinical. So the first 3 and most important things you want to make sure you have for clinical is your lab coat. The first 3 important things you want to make sure you have: your lab coat, your badge. I don't have my badge because it's in the car and I forgot to get it. Plus, I mean, it ain't that cute of a picture anyway. So your lab coat, your badge, and your stethoscope. And I guess the 4th thing with that is making sure you're dressing presentable for when you're in clinic. As a nurse practitioner student, there is no dress code. The only part of your dress code is your stethoscope, your lab coat, and your badge. So I have my lab coat. Honestly, I sometimes I wore it, sometimes I didn't, just depending on how hot I was feeling, or you know, just depending upon what was going on. But it is important that you have it because some preceptors, some clinical instructors are sticklers, and they want to make sure you're representing the university well. And by representing the university, you need to make sure you have on your lab coat and you look presentable. For me, where I was doing my clinicals, I didn't have to wear business casual. And fun fact is, as soon as I got accepted into nurse practitioner school, I'm like, Mom, I'm gonna need clothes. I'm gonna need nurse practitioner clothes. And so we went on like this humongous shopping spree. I shouldn't even say it, but we went on this really big shopping spree, and I bought all of these clothes to wear to clinical. And guess what? COVID hit. First of all, COVID hit. So I was doing, first of all, it took me forever to get clinical placement because getting clinical placement as a pediatric nurse practitioner student is very difficult. And so I didn't get placement until a month into the year. And so school started, what, the first, second week of January, and then I didn't get clinicals until February of this year, which was like, I was like, so like, I was anxious because I'm like, I have so many hours to do and I haven't started yet, and people have already started. But anyway, so didn't get placement until later. So therefore, a whole month of, you know, not having to wear my cute little nurse practitioner clothes. And then finally started my my mentor. She took me under her wing and she was like, just wear scrubs. Wear scrubs. I wanted to wear my cute clothes. So yeah, I wear scrubs to my nurse practitioner clinicals. And actually, I love these Skechers scrubs. They are super comfy and you can move in them. They're not restricting. So, but just make sure you know what your dress code is for your clinical site, and make sure you look presentable because you are representing the university. You are an extension of the university whenever you are on your clinic. Nice and presentable. Make sure you have your lab coat, make sure you have your badge, your stethoscope, and your dress accordingly. So we're going to actually get into what I take to clinical besides these items, of course. I never put my coat in my bag because, you know, making sure your coat is nice and pressed, clean and white and crisp is key. Of course, I have my phone. Got my handy dandy phone, my handy dandy planner. I have my planner because, you know, as nurses, you guys, you know, we live and breathe by this planner. Nothing's different as a nurse practitioner either. Oh Lord, my planner. Y'all wanna see my planner? Let me show y'all. Is full to the max. So take your planner so that you can make sure you have your clinical days all planned out, all prepped out, making sure you're adding up your hours. I mean, I spent almost every clinical shift making sure I had enough days, I had enough hours, making sure I'm adding up my hours. we need 500 hours to sit for boards, and every semester we had to get 180 hours, so that's 540 hours total for my program. Each program has different hour requirements that they want you to have. Just make sure you know your program's requirements. For my program, we needed 540 hours to graduate, 500 of which are needed for to sit for your board certification exam. So I live and breathe by my planner, as you guys know. All right, up next, of course, you have to have pens. Right now, because of coronavirus, I do have my own N95 mask that I was taking to my clinical site, just in case they didn't have enough to provide for me and they had only enough for their employees. I took my own goggles and I took my own N95 mask with me. Alrighty, bright futures. I think I've talked about this in one of my weekend lives of a pediatric nurse practitioner student. If you are a pediatric nurse practitioner student, this bright futures pocket guide, I'm actually going to order the bigger one. The bigger one is like $100 and something, but whatever. I want to just make sure I have all the resources that I need to effectively be the best nurse practitioner that I can be. And bright futures is another one. So this is basically anticipatory guidance for your well child visits when you're seeing your patients in the office. Oh my gosh, another great book is Pediatric Primary Care by Beth Richardson. I love this book so much. I used it all throughout school because it has diagnoses, treatments, and it gives you the nitty-gritty bullet points on what you need if you think this is what your patient has. And I love this book. And part of my study plan, I know I said I'm gonna do a separate video, is making sure I read all of these books front to back is gonna be a part of my study plan. And I'll once again go into how I'm gonna do that. But for pediatric nurse practitioners, you need this book. All right. And I also take my Pediatric Nurse Practitioner Certification Review Guide. And 7th edition, this is the newest one that I'm using to study and prep for board certifications. I also took it to clinicals with me because once I presented my kids to my instructor, if I didn't know something, she allowed me to look up, okay, what am I leaning towards? What diagnosing am I leaning towards? What treatment plans am I leaning toward? So I did take this with me because just like that Beth Richardson book, this is a really good bulleted book, straight into the point about what you need to do when you're diagnosing a specific diagnosis, treatment, education, and things like that. And even, you know, of course, how to making sure you're leading yourself to the right diagnoses. Are there any diagnostic studies that we need to perform? Is it just, you know, clinical observational diagnosis, or is it a test that we need to run to confirm diagnoses? I love these books. And if you are a pediatric nurse practitioner student, you need to get these books because these will be your Bibles as well. Our next Bible for pediatric nurse practitioner students is the Woolly Mammoth, the big one. This is the Burns Pediatric Primary Care. I'm not sure if I've said this, but I am getting my pediatric primary care certification. So as a pediatric nurse practitioner, you can either do primary care or acute care pediatric nurse practitioner, or you can do a dual program. Some schools offer dual programs. I decided to go to USF because one, they provided clinical placement for you, or they search for clinical placement for you. Another alternative school that I was going to look at was UAB, which is the University of Alabama at Birmingham, and they do have a dual certification program there. But I was afraid of what it took to find my own clinical placement, because I have heard horror stories from other students about how difficult it can be to find your own clinical placement. So just keep that in mind when you're applying to schools, or even when you're researching schools, to see if they provide clinical placement for you, or if you have to find your own clinical placement. For some nurses, it's easier because some nurses may work in a field already where they can get pediatric, or they can get their own clinical placement. I work for this doctor. I'm going to go to school. He knows you're going to school. He's going to let you do your clinical placement there. That's a little, you know, a little bit easier. With me moving to a new city, I didn't really know many doctors or nurse practitioners here in the area, so that's why I chose the school that I applied for. But I am doing primary care. I said all that to say I am going to be sitting for my primary care certification, and the Burns book is for primary care, and it is our holy grail, our Bible of becoming a pediatric nurse practitioner. This is everything that we should know and need to know for boards as well. So a part of my study plan as well is hopefully try to read this book front to back. Yes, I know, crazy, but I always set crazy goals for myself. Somehow I usually achieve them. All right, you guys have already saw this book. This is my note-taking tablet here. Isn't that cute? It's Erin Condren, just like my planner. And then I have this folder. So this folder, what I decided to do is to go ahead and just keep track of all of my patients that I saw. And so these are my fall 2020 patients, and I showed you guys my report sheet. And these are all my, I should say report sheet, but these are all my note-taking sheets that I took in whenever I went to go see patients. This paper has everything that I need to ask to basically get to the bottom of their chief complaint. Why are you here? Why exactly are you here to see me? What's been going on? How long has this been going on? What have you done to make it better? Has anything you've done made it worse? Family history, drug history, surgical history, the patient's medical history, any medications that they're taking, their immunizations. Immunizations are very important for pediatric providers. Are your immunizations up to date? Because that can kind of lead you to your diagnoses a little easier and faster. So I keep all of my report sheets here. And in my clipboard, I have the blank report sheets. So your school is going to provide you with some type of time log, time log keeping system, patient tracking system to make sure, one, you're keeping up with all of your hours that you're supposed to be getting for graduation, and two, you're keeping track of all the patients that you've seen. What type of patients are you seeing? What type of diagnoses have you treated, have you seen? And it's just a record keeping system, and you can also use it to print out all the different type of patients that you've seen, to include in your portfolio or your resume, to your hopeful potential future employer, to show them this is what you've done during clinical. Not just, you know, you've studied the book, but you've actually saw patients, treated patients on your own. So this is one of the books that I purchased during my program, and it's a pediatric physical examination book, and it's an illustrated handbook, and I mean, it's pretty self-explanatory. I can accurately assess my patients, make sure I know what I'm looking for, listening for, observing for, and it's just a really good book. And it also has different techniques on, you know, how to successfully assess different body systems, and it goes basically from head to toe on how to assess your patient and to know what the norms and what the normals and abnormals are. It's a book from this semester, so it's the Nurse Practitioner's Business Practice and Legal Guide, because there unfortunately, I shouldn't say unfortunately, but there is a business side to being a nurse practitioner. Billing, coding. I talked about malpractice insurance in one of my videos, in my what to do next video, and this is by Carolyn Bupert. This is really good because it provides you with ways on how to avoid malpractice and other lawsuits, what it takes to be a nurse practitioner guidelines by state, nurse practitioner scopes and standards of practice by state. You really need to know the legal business side, because as I said in a previous video, people, you know how people are in the United, especially, I don't want to say United States, but I live here in the US, so you know, people always looking for a quick buck, and suing somebody is, you know, someone's way of making a quick buck. More report sheets. When I first started, I was cutting them up, but I'm like, nah, that just takes too much time that I don't have. All right. And so the last thing I have is another note-taking apparatus. I mean, come on, Jenean, how many notebooks do you need? Why did I just call it an apparatus? I have no idea. But another note-taking pad. So this one is what I deemed my pediatric clinical pearls. You guys know I love my pearls of the day. So this just comprises a bunch of information that I've learned over the last year in actual practice, and just some key things that I wanted to write down and keep very close and handy just in case I needed it. Like, don't forget to prescribe prednisone for croup-like cough. Or so this book pretty much just has things like that, and like dosing for prescribing medications. It's just something that I started writing out myself, and that I may hopefully can get this in production into you guys. There's some quick clinical pediatric pearls that you can have for when you're in practice. And that is it. As advanced providers, you're seeing patients, but there's also a little downtime, and you can, you know, make sure you have your resources with you to read during those downtimes, making sure you are furthering your knowledge, furthering your education, making sure you're making use of every moment and minute that you have. Yeah, that is it, you guys. It was really quick. Nothing too major. I just take a bunch of books to school or to clinical, as you can see. But the main important thing is creating some type of report sheet. I call them report sheets because I'm a registered nurse. But creating some type of nurse practitioner brain for yourself, so that you are accurately lead you into the right direction for a clinical diagnosis, and making sure you're accurately diagnosing these kids. And if you have a question, come look at your book. You're still a student. This is what clinical is for. Clinical is for you to learn. It is a learning opportunity. It is not an opportunity for you to go in there and pretend like you're already licensed and certified as a provider. This is the time where you ask questions and you continue your learning. Continue to facilitate your learning environment is what clinical is for. And clinical is also for to actually see these things in real practice that you see in the book. And one important thing that I would love to pass on to you guys is sometimes the patients don't exactly present 100% the way that the book presents it. And that's what I've really learned in clinical. You have to know that it could be a little bit different, a little bit off than what the book has said, because like my mentor says, the patients do not read the book. So just making sure you have the right resources so that you are once again facilitating your learning in the clinical experience. And that is everything that I usually take to clinical with me, in addition to my computer, which I forgot to get. But I also take my computer to clinical because I keep track. I just go ahead if I can, if there's any time. Sometimes there is, sometimes there isn't. But I like to go ahead and put my patients in our tracking system that my school purchased for us to use. And just to kind of get that out of the way, I know one plight of advanced providers, especially in primary care, is they have to do a lot of charting still after they go home. So if you try to get in some type of routine of charting as you go, I think that'll benefit you in the long run as well. Alrighty, and as always, thank you guys so much for tuning in to Jenean's Journey. You guys already know what to do. Make sure you give this video a thumbs up. Make sure you leave any questions you have down below. Make sure you subscribe, and make sure you what? Let me hear it. Make sure you tell a friend. And I'll see you guys in the next one. Bye. I mean, because this is the last time I'm going to unpack my bag as a clinical student. That's so crazy. I'm going to be a nurse practitioner. Nurse practitioner. Yay. All right, let's see. Hi you guys, and welcome back to Jenean